I was not diagnosed with schwannomatosis until the age of 30. Around the age of 25, I started having issues with my left leg. It would go out from underneath me. Went to an orthopedic surgeon who at that time performed an MRI, and that's when they found my first tumor. When I was first diagnosed, I had no clue what it was. I was in shock. I was concerned. I didn't know what the future held at that time because I was told it was a rare genetic disorder. And not knowing how many tumors I had, what I was going to go through, what type of surgery, what type of procedures that the doctors were going to have to perform.
It made it much tougher for her, there's no doubt. When you go through pain like she went through and is still going through, it's got to affect your life in all sorts of ways. And the saying, she is a fighter, she is. I mean, she's fought through a lot of pain and a lot of struggles, but she's still great.
She is passionate as anybody I've ever met. She cares about everybody she runs into who may have this disease, and that never give up attitude that she has, I think helps carry her a long ways with the difficulty she's dealing with.
I think it has inspired her to be more passionate about her life, about helping others, and being involved in the Children's Tumor Foundation. It's actually increased her awareness of suffering of other people.
To me, you have to look at a positive and the negative. And this genetic disorder is a negative, especially on the small children. But it's given me the opportunity to just really sit down with some of the younger individuals and say, hey, you are a fighter. You've got this. You can do this. And I am here to walk beside you and with you on this journey. My involvement with the NF endurance team is because I am an active runner and because I'm very active in sports. I want to be able to put CTF's name out there and for people to say to me, what is the Children's Tumor Foundation? What is neurofibromatosis? I've had some amazing opportunities, like when I ran the Nashville half marathon, people coming up to me and asking me those questions, or meeting other individuals who are running for someone that has neurofibromatosis.
In so many ways, Michelle has impacted my life, and I see her impacting so many others' lives. And I can't think of anybody to be a better ambassador for this disorder. Knowledge is power, and we need to get the knowledge of NF out to the world. And she's the one that's going to make this happen because she cares so much about other people.
Being the CTF National Ambassador, I'm honored to be able to tell my story, and not just my story, but to tell the kids' stories. I am here to fight for you and with you to raise as much awareness and as many funds as we can to support our cause. And that's something that I am very, very passionate about.
Hi everyone, good morning and welcome. Thank you so much for coming to our NF2 Continuum of Care Summit presentation. My name is Dr. Heather Thompson. I'm a speech-language pathologist by training. I serve as an associate professor in the Department of Communication Sciences and Disorders at California State University, Sacramento. I'm also an itinerant speech-language pathologist, and I serve in Sacramento City Unified School District, and that's a part-time position that I hold. And I also serve as the speech-language pathologist discipline director for the Northern California LEND program, which is the Leadership Education in Neurodevelopmental Disabilities at UC Davis Mind Institute. Caring for individuals with NF1, NF2 related schwannomatosis, and schwannomatosis and the rhesopathies is a passion of mine, and I am in particular highly interested in holistic care as it pertains to quality of life and speech, language, and swallowing. So it's such a privilege to be here today and to meet each and every one of you and work with you today. I'd like to introduce our panel for our NF2 Continuum of Care. And next I'll turn it over to Dr. Ariel Kassar.
Hi, thank you so much. I'm so happy to be here. So, like she said, my name is Dr. Ariel Kassar. I'm an audiologist. I also work at Sacramento State University. I am the clinical education coordinator. I started in that role in February, so I'm pretty new. Before that, I worked in London, England at a private practice, and really I see patients across the lifespan dealing with hearing and balance care, diagnosis, and treatment. So excited to be on the panel today and tell you all about audiology services as it pertains to NF.
Good morning. I'm Susan Bono, and again, I'm very happy and feel privileged to be here and talking with you all. I am a retired special education teacher working with children with primarily learning disabilities and comorbid conditions for about 30 years. And in addition, I've been the mother and wife of a family of individuals with NF2. My late husband, who was diagnosed in '88, was one of the early recipients of the ABI. And both of our children, one of whom is here presenting, if you heard him yesterday, are individuals challenged with NF2 as adults. Thanks.
Hi, I'm Michelle Harvey. I'm with Children's Health in Dallas, Texas, and I'm an education specialist that works in our Center for Oncology and Hematology, and I work specifically in a clinic dedicated to patients with NF. I'm blessed to be able to work with all of these wonderful individuals and assist in providing educational services, communication to the education community, helping them understand the disease and the unique challenges that our patients and families face. I also work to assist in transition to the adulthood program and college and career readiness. And my goal is to make the opportunities available to them that are available to all children, and how they can become successful adults in their adult life and provide them with the services that they need to have a successful educational opportunity.
So the purpose of this panel today is for us to really talk about continuum of care. And while we work with neuro-oncology and different surgeons, ENT, different medical professionals, we also want to draw your attention. We appreciate all of the work that they do, but we also want to draw your attention to this idea of rehabilitation supports, educational supports, and the concept of there's a continuum of care, not only across the lifespan, but across disciplines, and we're all here to support you. So we've prepared, as part of this panel, 3 cases, and what we're going to do is each share our various perspectives on how we might provide care for these various cases that we've created for you today. So the first case panel, is everybody ready? We've got about 30 minutes or so. Okay, so this first one we'll spend about 12 minutes on. Okay, 9-year-old Liam was diagnosed with a family history of NF2 and was referred to audiology following I got all choked up for a second. Hearing concerns, and an audiogram revealed unilateral sensorineural hearing loss. So first I'd like to turn it over to Susan.
Thank you. As a parent, and I just want to share that I've spoken with some folks here in the last day or so, and I think parents share a common understanding of the heaviness of the responsibility in decision-making that comes to you when, oh my goodness, suddenly out of the blue, your child is ill and it's a disease that's rare and you are unfamiliar, and what do you do? Questions that come up that I want you to know are shared by all of us are some of the following. How do you know you're making the best decisions? Briefly, you make the best decision, in my experience, for the time and place that you're at. There is no right and no wrong. I just heard the surgeon from the house speak about how he goes about making his decision. Your decision as a parent is then informed by what you know best about your child and by all the research that you can do as a parent to make the best educated decision at the time. I think I need to emphasize that there's going to be a long haul. And I think when you first are confronted with this, that awareness maybe isn't as, oh, I'm sorry. Oh, I'm sorry. Okay. I'm not so, oh, that sounds, I can get the feedback. Maybe you're not aware of the fact that when you make a decision for the time and place, for whatever recommendation is coming to you for the child, for this 9-year-old, all these questions start spinning, and I want you to be mindful that you're going to make a decision for that time, and yet you want to maintain a longer perspective. Some friends of mine offered these questions just to throw out to you. What does this mean for my child? When will they need surgery? Will they need medications? Will they be deaf? Do we watch and wait and watch? Who do I need to see? Do we as parents need testing? Do their siblings need testing? This is the type of thing that has to go spinning through your mind when you're fumbling with how to best serve your child.
And Susan, just with 1 minute,
please.
Could you talk just a little bit about some things that you wish you had?
Oh, well, that's the next. Shall we move on?
I think we should, just in the
Okay,
interest of
sorry.
time.
Okay, may I see the next slide, please?
Yep.
May I
Oh,
s-
and it says right there on the left.
Oh, I'm sorry, there
Yep.
it is. Okay.
Absolutely.
Please know that there's a disciplinary bias that I learned about what recommendations your doctors will give you. You'll see a surgeon, maybe two, hopefully more than one, neurosurgeons, surgeons that specialize only in spine, surgeons that specialize in brain. Please know that they're offering you their best information at the time, but you may get a contradictory recommendation from a radiologist. So please be aware of that. Please know that you need to model perseverance for your children. My guess is you will, but your child will pick up those cues. Please exercise patience, because a wait and watch is not non-action. A wait and watch might be the best decision for the time, given this long haul I referred to. And then always never doubt the strength of your children, because they are amazingly resilient, and I've learned so much from just watching how both my kids have managed this over time.
Thank you so much, Susan. Thank you for your perspectives. And next we'll move forward to Michelle. Would you like to talk a little bit about your perspective?
Yes, and I have a lot of information to share, so I'm going to try to get through this as quickly as possible. There will most definitely be information on our resource page for you to refer to if you miss anything or to dive deeper into these details. So a new diagnosis and potential learning issues could result in a multitude of things. What I would like to encourage you to do is that when you find out that you have a new diagnosis and you're meeting with your clinical care team, the first thing I'd like for you to do as the parent or the patient is to ask who your support person is going to be for educational services. That can vary across hospitals. So I think that's a very good and important step. It could be an educational specialist like myself. It might be a social worker. It might be a child life specialist. It might be your audiologist or speech therapist, or whomever is going to be a support person for you to help you synthesize this information between the medical community and the education community, because they don't always speak the same language. So I would like to talk a little bit about some of the issues you might face: attention, cognitive issues from tumor growth or cranial radiation, potential for learning disabilities, potential for visuospatial skills, potential motor skills issues. These are just a touch point. There may not be a thing that affects you at this time, but things that you might need to look forward to. By being able to be knowledgeable about this diagnosis for yourself and being able to communicate your needs and the diagnosis to your education community, you have the best success, opportunity for success, because sharing of information is key. They need to understand what you're struggling with and how they can best support you. And we are here to help you as an education specialist, myself, to give them those details, determine the appropriate support staff at your school, help initiate a process for determining services, help provide written documentation from the physician. That always helps to expedite the process. Getting documentation such as, and we will discuss this, other health impairment forms and so forth, letters, anything that can explain what is happening and how we can get services initiated quickly for you.
Okay, excellent.
Yes, I'm sorry.
Sorry, I'll take that. Excellent. Thank you so much. So there's a couple of other things around potential moderators of school success.
Yes.
Yeah.
So I apologize. I wasn't mission through. In terms of moderators for school success, things you may run into are absences from school due to clinic appointments, frequency of appointments. You may have auditory impairments, vision impairment issues, medical treatment related issues, psychosocial and psychological support services. This is a new diagnosis. It's going to be stressful for you, for your family. Stress, as we know, impacts people's educational outcomes, and in conjunction with the things that they're facing, we want to make sure they're able to have good mental health support as well. Your school support, family adjustment and support.
Perfect. Thank you so much, Michelle. And so now we'll move forward to audiology. There's some additional slides that are in the presentation that we'll post at the end as well. I think that's important to talk about, like the other health impairments. So
Thank you.
We'll circle back to this as we go forward.
Okay, I'm sorry. Thank you.
So we'll move over to audiology. Yeah, Dr. Kassar.
Yes, so your child went to the audiologist for a hearing test, and this is their audiogram. A unilateral meaning one-sided, moderate to severe, which indicates the degree of hearing loss, sensory neural, meaning permanent damage to the organ for hearing, and that this is their hearing loss. So it's important to remember that the specific impact of a hearing loss can vary from one individual to another. The child's specific hearing loss, individual resilience, and coping skills can influence the extent to which these effects are experienced. All individuals should have knowledge of their diagnosis and what is being tested during the hearing assessment. So the hearing assessment consists of the following components: pure tone audiometry, which tests the lowest sounds that you can hear across different pitches. It also indicates the type and degree of hearing loss. You have speech audiometry, which tests for speech recognition ability, intelligibility, and your speech and noise understanding. And lastly, admittance testing, which tests the function of the middle ear and parts of the auditory pathway.
Yeah, excellent. Perfect.
So the hearing assessment results serve as the basis for determining the student's eligibility for specialized services and understanding the specific needs related to their hearing loss. So audiologists will share these results with the educational team, and specifically, if the school has one, an educational audiologist. So it's the educational audiologist's job to collaborate with parents, teachers, and other professionals on the team to make recommendations specific to services such as accommodations or assistive listening devices to enhance the communication needs of the student. Again, these recommendations can include assistive listening devices such as an FM system or induction loop system, hearing aids, oral rehabilitation, preferential seating, what have you.
Excellent.
Also, based on the assessment, the educational audiologist contributes to the development and implementation of an individualized education plan or Section 504 plan. So they make recommendations, again, based on classroom acoustics. They may make changes based on the assessment of speech intelligibility, background noise, and general listening environment. Yeah, so some unilateral hearing loss considerations, and again, this will be on the Whova app, so you can read in more detail, but some considerations are obviously academic performance can be hindered, social and emotional well-being, attention and listening skills, and balance and spatial awareness. So next, I'll just go into those with a bit more detail about the management considerations for those. So, you know, with academic performance, Ways to improve that are classroom accommodations, such as preferential seating, a note taker, optimizing classroom acoustics, such as putting down a rug or tennis balls under your chairs. That all helps to minimize any sort of background noise and ambient noise in the classroom. The use of assistive listening devices like an FM system that could be paired with your hearing aid. Some classrooms will have an induction loop or Bluetooth system as well. For attention and listening skill issues, you want to break tasks down into smaller, more manageable parts. Breaking down these tasks helps to avoid auditory fatigue. It also provides opportunities for rest and recharge during periods of intense auditory processing. So you can use apps such as the Focus app, which help to time certain tasks and give organized breaks. To promote social and wellness and emotional wellness, you want to encourage students to be open with their communication, explain their diagnosis to friends, family, teachers, and help them to use strategies such as asking for repetition or rephrasing when something is misunderstood. And lastly, for balance and spatial awareness, you want to engage in physical activities that promote balance coordination. So something that's good for that is yoga, Tai Chi, even dancing, just some sort of body movement that helps someone to be mindful about their coordination.
Thank you so much. That's excellent. And then from a speech language services perspective, we also think about, because the same mechanism that's used for speech is also used for swallowing, we want to make sure that the child has speech language assessments and also that swallowing and feeding status is also monitored. So I want to look at oral motor structure and function and make sure that the mechanism is appropriate for speech and to maximize communication efficiency and effectiveness. I would also want to do an evaluation if there was any concerns with swallowing disorder or if food was going down the wrong pipe. We want to make sure that the appropriate medical intervention is provided, but then also swallowing evaluations are done to see if we need any modifications. So because this child's only 9 years of age, this is something we would look at and monitor and just attend to because we definitely want to prevent that aspiration pneumonia or infection, basically like infection that happens from food going down into the lungs and then causing pneumonia. So we want to prevent that. And so then we would just recommend following up with speech language pathology as needed and possibly explore the use of oral rehabilitation to maximize communication potential for that child as they age. So, all right, so let's go with case B. So I see a lot of adults in the room. Thank you so much for being here. I think these next two cases will apply even more to you. So 22-year-old Ellie is diagnosed with NF2. Ellie is hard of hearing and elected to participate in a MEK inhibitor trial. Their hearing improved during the trial, but is now beginning to worsen. So again, with just about 10 minutes for case B, we'll start turning it over to Michelle. Do you want to start from here?
Thank
Okay,
you.
all right.
So thank you so much. So in the previous information, I would have shared about Section 504, which Ariel touched on, and IDEA, two programs that are different. 504 is an Americans with Disabilities Act program, and IDEA is specific to special education. And the types of services that you, as moving into your adulthood, would receive would be different than what you would have received in your elementary and secondary education programs. That means that the types of accommodations that you receive and modifications will look different. So under Section 504, the individuals with disabilities do have the right to accommodations that allow them the equal opportunity for success, and these can apply in a college and career setting or vocational training program in the community or in employment settings. So as an adult, it's now your responsibility to be able to communicate these needs. So what we hope you would have learned in your elementary education as in preparing and secondary education and preparing for this time is that you would have self-advocacy skills, that you would learn self-determination skills, and that this would all be part of your transition process. These are the different roles in which people would play in terms of whose responsibility is it to do the communication piece of your disability towards your education community, employment community, or whatever it is that you're needing for support. They must be able to communicate clearly. Thank you. Some of the obstacles you might find would be concerns with confidentiality, So you need to identify, will this disability affect my status, my academic record, difficulty with self-advocacy, the understanding or ability to be able to articulate for yourself what your needs are or your child's needs, difficulty completing the steps necessary to receive the services, or a student's attempt to decide what kind of program do I need. Is it going to be a four-year college, or is it going to be more of a career technical skill program? Or do I just need to go and take classes and sort of experience something to learn what my interests are and what my ability to be able to participate might be?
Yeah, perfect.
Changes from high school to post-high school, there's reduced parental involvement, as you know. Students become their own advocates. They must take multiple steps to access support services, and there must be self-advocacy. That skill of self-advocacy should be starting around 13 or 14 years of age. They need to be part of their 504 or special education plan meetings so that they can start to learn the language that they need to speak, so that their employers, their college community, resource support services know and understand the language that they're sharing with them in terms of being able to say, I need these types of accommodations, and be very clear about how they've benefited you in the past. These early opportunities are going to be your way to practice this skill for adulthood so that you can prove in written documentation from plans that you've had in the past that these support services have benefited you and that you need to continue to have them in order to be successful.
Yeah, perfect. Thank you.
Thank you. Lastly, we want to talk about the documentation for accommodation. Like I touched on, having that initial piece. Colleges have very specific processes for obtaining services and documentation. They must be provided to the appropriate department, which is named different things. It could be a student support service center. It could be a disability rights center. You need to identify what that support service program is at the college campus or junior college or wherever you're looking. So that you know exactly what department needs the documentation that you're providing, and be sure to provide copies of everything. Keep them for yourselves so that you can continue to share these as you move through your college career. The time that it takes to initiate these services can be lengthy, so be prepared to start this process as early as possible.
Excellent. Thank you. So jumping a little bit forward, we'll turn it over to Dr. Kassar.
Yes, so if someone is on a trial for MEK inhibitors, undergoing surgery, radiation, or other types of drug therapy, it's important for audiologists to obtain a baseline of hearing at the time of diagnosis to establish a reference point for hearing function to compare to future hearing assessments. So this is very crucial during the trial period especially, and by regular hearing assessments every 6 months or sooner. So hearing assessments performed at regular intervals help to track any changes or progression of hearing loss in order to adjust the treatment plan accordingly. Serial audiograms can also help in detecting the presence of new tumors. In NF2 patients, if there's a sudden decline in speech intelligibility or more development of an asymmetric hearing loss.
Thank you.
So early detection of hearing loss means early and timely intervention and management. So choice of treatment may depend on factors such as the degree of hearing loss, individual considerations like patient motivation, lifestyle, finances. So it's important to note that the tumor size and location doesn't always impact the degree of hearing loss. So we'll be discussing timely intervention and resources for management of hearing loss on Saturday. So if anyone wants to come to that panel, we'll be talking about that more in detail.
I think that's a really important consideration that, you may have a very large tumor and it may not have as great an impact on hearing.
Right.
But have a very small tumor that has a very significant impact.
Yeah.
Yeah, absolutely.
Yeah, so some technological treatment options for hearing loss include hearing aids. Obviously, hearing aids amplify sounds to improve speech and hearing and speech comprehension. They're particularly useful in background noise situations as they help to reduce the signal-to-noise ratio. There are 7 major manufacturers to choose from. They each have varying product range and features. Second to that would be cochlear implants. So that is a device used when hearing aids are no longer an option. So that's an electronic device that bypasses the damaged part of the organ for hearing, the cochlea. It stimulates the auditory nerve directly, and they are there's a candidacy evaluation to determine candidacy criteria. So there'll be a series of tests where an audiologist will perform your hearing results with and without hearing aids, as well as in quiet and in background noise situations. Additionally, an MRI or a CT scan is also needed to check the viability of the auditory nerve. Once a patient meets criteria for a cochlear implant, there are 3 major cochlear implant manufacturers to choose from. Again, they all have variability in product range and features, but they are more similar than they are different. And lastly, in regards to medical management of hearing loss, would be an auditory brainstem implant, which Susan alluded to that her husband had, an ABI. So when cochlear implants are no longer an option due to the damage to the auditory nerve, this bypasses that and stimulates the brainstem directly. So ABIs are more common for individuals with bilateral hearing loss. However, unilateral, severe to profound sensory neural hearing loss can be considered as well.
Yeah, and thank you so much for all this information. I also think it's important to recognize, and we know in speaking with all of you throughout the past several days, that individuals with NF2 might not use their aids or assistive listening technology all the time, or they may only use it at some points of the day or for some sorts of activities. And so I think it's important for patients to make sure that they're accessing their audiologist to have open conversations about what works and what doesn't work, and really get that perspective around why is something working or not working, so that the optimal hearing situation can happen.
Yeah, and I just something to add, your audiologist will probably tell you, wearing your devices for just intervals in the day is probably not what we would recommend, just because the more you wear your device, you're continuously stimulating your auditory system. Our ears are like a muscle. If you don't use it, you lose it. So by wearing your hearing devices, they actually help to keep that auditory pathway stimulated. So the longer you wear it, the more your brain gets adjusted and you're getting all that auditory input, even in situations where you feel like you might not need to wear it because there's no background noise or what have you, but the more you're stimulating that system, the better.
Yeah, absolutely. Thank you so much for that.
And these are just briefly, I'm sure Heather will probably allude to these more, particularly with oral rehabilitation, but these are some non-technological approaches to hearing loss. So AR, which really helps with certain communication strategies, like preferential seating and using certain lighting, visual cues. Sign language is also a good tool for visual and expressive mode of communication. And again, assistive listening devices are low-level tech that can help, when you have a hearing aid or even without a hearing aid, there are personal sound amplifiers that you can get over the counter kind of thing. Yeah.
Thank you so much. Yeah, so that's one of the things where audiology and speech pathology can work really well together. So an audiologist will do the evaluations for oral rehabilitation, and then a speech-language pathologist is the professional who can provide the oral rehabilitation therapies. And so things like speech reading and lip reading and other sorts of modifications of the environment, structuring your environment for optimal listening or communication situations is what a speech-language pathologist and audiologist rehab team can do to provide support. So when we think about, this continuum of care, we think about as hearing becomes a concern, there's other strategies that we can utilize. And I know in speaking with many of you throughout the week, you've accessed these services. And so I look forward to talking with you more about finding out from you what works and what hasn't worked in the past, because that's a very, very important viewpoint that we have as we work forward and make more decisions. So for speech-language services, again, just like with the 9-year-old case, I would say we want to make sure that oral motor structure and function is appropriate for speech to maximize communication efficiency. We want to look to make sure that to the greatest extent possible, communication is easy and as effective as possible. And then I'm still going to monitor that swallowing and refer to a hospital for that evaluation of swallowing if that becomes an issue at all. Okay, so we've got about 8 minutes left for case C. And I wanted to turn it over to Susan for case 2 for a second. Is there anything additional that you wanted to share about case 2, or do you want to move to case 3?
I think given the time, thank you.
Okay,
Go ahead.
Okay,
Thank
so
you.
case C, David is a 35-year-old in the workplace, and he's currently use different technological assistive devices and is working with human resources when necessary to accommodate disabilities, including significant hearing loss and mobility. And so where do we begin? So Susan, I'll turn it over to you.
Right. So you're in the workplace. Your youngster is grown now, independent individual in the workplace. What should he or she be doing to self-advocate, as my colleague mentioned here, that has to start at a younger age? Hopefully they've had some time to practice those skills. You can begin by evaluating your communication needs and identifying specific challenges you face in the workplace due to your hearing loss. Do a self-assessment. Research your rights. Familiarize yourself with the laws and regulations that, excuse me, but would you like to continue this?
I'm so sorry.
Are you all right? I'd like my colleague to continue the slide, which
actually do this, yeah.
belongs. Okay, is it yours?
Yes, it is. Yeah, so again, as Susan was saying, you want to research your rights, familiarize yourself with the laws and regulations that
That was
protect
yours.
individuals with disabilities through the ADA, and understand your reasonable rights to accommodation. Again, and number 3, consult with your audiologist, seek guidance for your, from your hearing healthcare professional about your hearing loss. They can, provide you documentation that can support you getting workplace accommodations.
Absolutely.
Yes, and so some states will have specific programs for actively working individuals who do not have medical insurance to cover hearing aids. The audiologist's job will be to perform the hearing assessment, which consists of determining your ability to recognize and understand speech in a sound field environment, both in quiet and in noise situations, with and without hearing aids. So trying to assess that benefit there. So once it's determined that you are eligible for, you meet the hearing aid criteria, you have a hearing loss, some states will cover up to mid-level technology, and individuals can decide to self-pay to cover the difference to upgrade to higher technology. The audiologists will, again, as I said, fill out any necessary paperwork with recommendations for amplification and workplace accommodations. They're there to provide support in terms of documentation for that.
Absolutely, and then also liaising with the Department of Rehab would be key as well. Yeah, within each center, so. All right, and now Susan, I'm so sorry. I think I made a mistake about who to pivot to, so here we are.
I was happy to have a moment.
Thank you.
So transition to the workplace. Again, I'm just going to speak to proactive measures that young people can do. Meet with your supervisor, discuss your hearing challenges, and after meeting, keep a detailed summary of what you've confirmed to be accommodations. Contact HR to confirm that the company's policies regarding accessibility to accommodations is consistent with what you've determined with your supervisor. And when you send emails and do interoffice communique, copy all parties involved as a backup.
Yeah, absolutely. Thank you.
It's very challenging to maintain the speed of discourse on virtual meetings with embedded delays. This is what I've been told in closed captioning, and then combined with the error rate in transcription, it can be exhausting for individuals with hearing loss to maintain vigilance, maintain accuracy, and if you've got responsibility in a multi-site meeting, you can find that there's some error rates. And you have to be able to cope with that. And one very proactive measure that I think one should do is educate your colleagues as to what it's like to live in that space. It's been suggested to me that actually putting your colleagues on, asking them to put themselves on mute and to follow closed captioning and simulate what your situation is might increase sensitivity toward the type of challenges one's facing when you're on a hearing loss. Would you agree?
Yeah, absolutely.
And just allow for that patience and the flexibility, because unfortunately sometimes out of just ignorance of not knowing what the situation is like for a person with hearing loss, they're thinking you're not paying attention or you're not getting the situation. So please educate your colleagues. If you have had the discussions that preliminary set you up for what accommodations you need, here are some of them. A platform that includes closed captioning, a recording of the I'm
Sorry about that. That was me.
Yeah. Okay, I'll move through that very quickly. Agendas given to the employee prior to a meeting are often very, very helpful when you know what's about to be discussed. Virtual and in-person calls should be recorded if needed. And here's the last one, any forms of pushback in terms of discrimination, which can be subtle, could be communicated to HR, and trying to maintain that proactivity is important. Sometimes it requires a fair degree of resilience.
Yeah. Thank you so much.
Thank you.
And I'll just briefly touch on the accommodations that you can request at your workplace as it pertains to hearing. So assistive listening devices like captioned, amplified telephones, personal FM systems, as I've mentioned previously before, and portable sound amplifiers are the big ones that come to mind. So these are certain technological devices that you can request.
Excellent. And then again, given the individual's profile, it's important to look at, with age, how is speech and swallowing impacted? And so we would want to do a comprehensive evaluation of speech, language, hearing, and swallowing. And then from there, execute a plan for oral rehabilitation. So whether that's learning about speech reading or lip reading, finding technology, assistive technology, and listening technology that works in all of the communication settings that you'll find yourself in is really key. And I want to mention that people don't have to have the latest or greatest technology. The key is to find technology that works the best for you and your individual communication needs. And with the pace of technology changing so rapidly, there's always new apps available and new devices available. And I mean, even in this room, there's so many different technologies and devices being used to support communication. And so I just want to encourage you all to continue learning and continue to share resources among each other, but also reach out to your speech language pathology team as well to, if you need other ideas, to make communication easy. I mean, that's really the key. We want to make it as easy as possible. And so there's additional resources that Michelle's provided as well. And do you want to talk about this a little bit?
I do.
Yeah.
And please forgive my coughing episode. I was actually wanting to mention, just to tag on to what you had said as well, that your state should provide you with employment, pre-employment transition services where you can get vocational coaching or career coaching, and access to many of the support services that were referenced in here, which is helpful because then you go into that job with the right information at the beginning and you're able to ask for those things up front when you meet with that employer, with the HR department, and your state can provide you support for that. And I strongly encourage you to do that because the coaching can really help you be that advocate in your job interview. They can assist you with resume writing. There's all kinds of ways that you can get help that you may not be aware of for things that may not have been presented to you before. On the resource page that I have here and in our resource page on our Whova app is an additional and very robust selection of information about transition services, a guidebook to transition services that you can dive into very deeply for career readiness and college readiness. It gives you questions to ask, a whole list of things that you need to consider as you transition into adulthood, and many organizations that are available to you for support services. I know many of these are based in Texas, but that doesn't matter because all the information they're sharing is most of these programs are federally funded. Some of them may be state funded specific to your particular state. So investigate at your state level through your Texas Health and Human Resources Department, or excuse me, with your Health and Human Resources Department or a Workforce Commission department within your state to find out how you can access these services. But these are great references here so that you can get all the details, all the questions to ask, and the types of things that you're looking for so that you know what you're looking for when you do go to those state agencies to request assistance.
So we're a couple minutes over, so we wanted to thank each and every one of you for your time today. We tried to button this up and keep a really tight presentation that would be relevant to all of you, but we're here for the rest of the conference, so please come up and ask us any questions. I want all the questions, and you can also put them in the Whova app as well. And thank you to each of you for your expertise and your background and your experience. I just really appreciate your time. And thanks to the CTF for giving us this time today. Thank you.